You're watching CoastLife, and you are probably seeing a lot of pink all around Delmarva. That's because October is Breast Cancer Awareness Month, a disease that affects many people here on coastal Delmarva. That is why we are at Beebe's Center for Breast Health in Rehoboth Beach, so that should you receive a diagnosis, you're getting quality care. We know that October is Breast Cancer Awareness Month, and it's pretty prevalent in our area, but also in the country. And here to tell us a little bit more about sort of the importance of getting yourself taken care of, getting yourself checked out, and what you can do if you receive a breast cancer diagnosis is Dr. Diana Dixon Whitmer. And not only are you a breast surgeon, but you're also the director of the Center for Breast Health here with Beebe.
And I am so happy that you are here in Beebe's Center for Breast Health. This facility, which opened just a little over a week ago, is much needed in Sussex County. Sussex County in 2020 and 2021 was the fastest growing county in the country, not the state, not the mid-Atlantic, but in the United States. This is a center where not only are there breast surgical oncologists like myself, Dr. Matthew Richards. We have just had join us a third breast surgical oncologist, Dr. Karen Barbosa. We have a nurse practitioner, Amanda Biro. But this is a facility where we actually can do biopsies too. So we know that this is going to reduce that anxiety-producing waiting time between when somebody learns that she has an abnormality on her mammogram or ultrasound and when she can see the surgeon, have the biopsy done, go over the results. We think we can compress that time to less than 10 days or less than a week.
That's awesome. And I think sort of speaking to that timeline, I mean, the fact that you've got so much in-house here speaks not only to the care that patients who receive a cancer diagnosis are going to receive, but like you said, the speed at which they're going to receive it. So maybe let's dive into some of the statistics, because chances are you know somebody who's been affected by breast cancer.
Breast cancer is now the third most common cancer cause of death among women globally. And unfortunately, the incidence of breast cancer has been increasing among women under 50.
Wow.
So there's multifactorial why this is happening. A lot of it is obesity, which is an epidemic in countries as they increase their wealth. Their population increases their girth. And that increases not only the risk of heart disease, but very significantly increases the risk of breast cancer. So right here in the Center for Breast Health, we talked about having radiology immediately available, breast surgeons, the nurse practitioners, nurse navigators, a very important element of the team. Nurse navigators help coordinate everything that happens for the woman from the time she's found to have an abnormal mammogram to the time she's finished with treatment for her breast cancer. And right across a small little road is Tunnel Cancer Center with radiation oncology and medical oncology, social services, all of that coordinated in one breast program, of which we are extremely proud. And I have to brag just a little bit about this breast program. Beebe has been accredited since 2013 by a national quality organization called the National Accreditation Program for Breast Centers. But last January, we were honored by being selected as one of 6 out of the over 600 accredited programs to pilot their new standards that will go into effect January of 2024, went into effect at Beebe January of 2023.
Wow.
And we've been able to provide feedback to the program to help them adjust slightly the standards to make them work better for patients and for the programs. So we are very happy that the emphasis on quality and the emphasis on patient-centered care at Beebe has been recognized nationally by allowing us to pilot these standards.
Let's talk about mammograms a little bit, because that's a very important part of the standard screening process, whether it's assessing your risk as well. There's a lot that you guys take care of to put women at ease and women who are at risk.
Mammography is important. Since mammograms in the United States became broadly utilized in the mid-90s, The mortality rate for breast cancer in the United States has plummeted by 30%.
Wow.
So mammography does save lives. It doesn't see every breast cancer. The general population, everyone should start at age 40. And they should have a mammogram every year until they have not 10 years of reasonable life expectancy. There are some new things coming along the pike that I think Beebe is going to be an early adopter of, and one of those is called contrast enhanced mammography, which is something that is as sensitive as MRI, much less expensive, and doesn't cause a problem for people who are claustrophobic.
You talked a little bit sort of at the beginning here about risk assessments that you guys do as well. So if there is somebody who maybe has a history, you guys can sort of do those risk assessments. What does that do for a patient?
The national guidelines now, both the American College of Radiology and the National Comprehensive Cancer Network, NCCN, strongly recommend that every woman aged 25 should have an assessment of her lifetime risk of developing breast cancer.
It's such a scary journey, cancer of any kind, but breast cancer being as prevalent as it is. But the team here at Beebe is so special and so, I mean, incredible and talented and perfect at what they do. Talk to that a little bit.
Beebe is truly Sussex County, and working with people at Beebe, especially working at my team here with the Center for Breast Health, is just a pleasure. We get notes from the patients all the time telling us about that too. And that makes a big difference because especially when people are going through the anxiety of finding out, even if they find out they don't have a cancer after the biopsy, it was stressful until they heard that answer. So having staff that are genuinely concerned about not just high quality care, but care that's delivered in a way that makes the patient comfortable.
Yes.
It's wonderful.
Quality and very personalized care, which is fantastic. Well, Dr. Diana Dixon-Whitmer, breast surgeon and director of the Center for Breast Health here with Beebe in Rehoboth. Thank you so much. This is such a pleasure talking to you. And I know that this information is a lot, but it's going to be super helpful for a lot of members of our community right here all along coastal Delmarva. Don't go anywhere because we do have more CoastLife coming your way. You're not going to want to miss it.
This segment of CoastLife was brought to you by Beebe Healthcare.